Welcome to the Amend Healthcare LOCUS Guide. As clinical staff, your task is determining exactly where a client fits within our continuum of care. We use the Level of Care Utilization System, the LOCUS, to standardize this process for adults 18 and older. Clinicians use the LOCUS as a collaborative compass, engaging the client directly to identify the specific service intensity they need right now. The assessment captures a person-centered view through 6 evaluation dimensions, from immediate safety to the living environment. You score each dimension from 1 to 5, where 1 is minimal concern and 5 indicates an imminent need. These scores generate a composite number, which you will then apply to a placement grid and a decision tree to reach a recommendation. This framework translates clinical observations to a recommendation consistent with AACP standards and the specific needs of the person you are treating. To see how this looks in the field, we'll walk through a collaborative continued stay review with a 34-year-old client. Keep the first rule of scoring in mind. Always select the highest criterion met within a dimension. When a situation is ambiguous, err on the side of caution and safety by choosing the higher of the 2 possible scores. This score tracker shows our first priority, Dimension 1, Risk of Harm. This measures the potential for significant harm to self or others, including substance-related danger or an inability to care for oneself. Our client reports passive thoughts of self-harm without a specific plan or intent, and shows moderate impairment in judgment. Under the LOCUS criteria, this is a score of 3. Note that if a plan were present, the score would rise to a 4 or 5. This is a clinical alert. You must stay with the client and immediately follow the Amend Suicide Risk Protocol. Dimension 1 is the most heavily weighted factor in the final decision tree. A high-risk score can override other factors to ensure the client is placed in a secure setting. Next is Dimension 2, Functional Status. This tracks how well the client interacts with others and fulfills social responsibilities. Rate the change from the person's baseline, rather than their absolute ability. The only exception is a client with chronic, stable deficits and no acute change, which you should score as a 3. Our client exhibits moderate difficulty in their major roles and a notable decline from their usual functioning, so we score this a 3. Dimension 3 looks at comorbidity, the impact of co-occurring medical, addictive, or psychiatric conditions on the client's treatment needs. Do not ignore stable medical conditions. If a physical ailment complicates the mental health presentation, it must be reflected in the score. Because this client has a co-occurring condition requiring concurrent monitoring, we assign a 3. These 2 dimensions require us to look past the primary psychiatric diagnosis to understand the client's holistic physical and functional state. Dimension 4, the recovery environment, is unique. It is the only dimension with 2 independent subscales that both contribute to the composite score. You must rate the environment the client will return to upon discharge, not the supportive residential facility they are currently in at Amend. In our scenario, the client's home environment contains moderate destabilizing conflict, which results in a 3 for Dimension 4A, stress. Dimension 4B, support, uses an inverted scale. A higher score means less support is available. A score of 5 means the client has no support at all. The client's return environment offers limited and inconsistent support. On the inverted scale, this qualifies as a 3. Scoring the return environment accurately is vital for safe transition planning, as it prevents us from discharging a client into an unsafe or unsupportive situation. Now we look at Dimension 5, treatment and recovery history. Only score history that is relevant to the current episode. You can set aside unrelated treatments or hospitalizations from decades ago. This client has a mixed history with an inconsistent treatment response, leading to a score of 3. Our final rating is Dimension 6, engagement and recovery status. Passive compliance is not true engagement. To score well here, a client must show both an insight into their illness and a willingness to participate in their own recovery. Our client is ambivalent, but acknowledges their problems and responds to motivational strategies. This meets the criteria for a 3. A client's actual level of engagement is a primary indicator of how effective a specific level of care will be. Now we sum the 7 ratings. Our client's walkthrough results in a total composite score of 21. According to this grid, a score of 21 estimates a need for Level 4 services, which are medically monitored but non-residential. However, the placement grid is only a starting point. You must always confirm the final recommendation using the decision tree. The decision tree weighs risk of harm and the lack of environmental support more heavily than the composite alone. In this case, those factors push the recommendation from level 4 up to level 5. The tree confirms that level 5 is the safest and most appropriate placement for this client's current presentation. Level 5 refers to medically monitored residential services. This is the 24-hour structured milieu we provide here at Amend Healthcare. When you complete your own assessments, remember the basics. Score to the highest criterion met, err toward safety, and always rate the environment the person will return to. Do not rely on the composite score alone. Use the decision tree and the weight of Dimension 1 to shape your final clinical recommendation. Thank you for your commitment to accurate, person-centered care. You are now ready to begin using the LOCUS with your clients.